Charlie Kirk was doing his show. If you didn't know how Charlie Kirk had a show, I'm sorry for being the one to inform you that yes, Charlie Kirk has a show, and it is very, uniquely and creatively called the Charlie Kirk Show. That's a name and creativity and like creativeness that I can respect as somebody who has a show called DylanBurnsTV. But he was speculating, complete speculation. Is it backed up by data? Not really. Is it even like somewhere close to reality? Not really. But he was on his show and he was speculating that between 123,000 and 1.2 million people, which that would be double who have died of COVID right now, if what he was saying was true, could have died after getting the COVID-19 vaccine. And he follows this all up, this huge allegation cited with barely any data that is on its face laughable. Because if it was 1.2 million people, we would see mass graves being filled. We'd see early New York grave type systems being implemented in the United States. We wouldn't see these deaths going down. We wouldn't see all these cases going down. We'd see a lot more cases of vaccine failure that actually kills me. We don't see that. This is completely nothing he says here. Not 123,000, not 1.2 million. None of it's true. And by the way, what a large range to make a prediction like this. 123,000 and 1.2 million. Wow. You know, guys, I want to sell you guys a car in chat. I'm a salesman. I'm DylanBurnsTV. If you want to buy a car, just be sure to drop a few gift subs in chat today or direct dono to the channel. But I got this. It's a good puppy, right? I don't know, like a Honda. Like, it's a good puppy, right? Look at this baby. Wonderful, wonderful car. And I will sell this car to you for $5,000 all the way to $300,000. So the price is gonna be in that range. So make a decision. Do you want to purchase this car or not? $5,000 to $300,000. It's a good deal. I don't know why you guys are looking at me like that. It's a great deal, an amazing deal. What's the gas mileage? That'd be an interesting question to ask after that proposal. Anyway, he follows up by saying, after that wide, completely, utterly unsourced claim, I'm not saying that's true. I'm saying that according to how we calculate VAERS, this could be true. Well, let me rephrase it for you. I'm not saying I'm lying. I'm just saying I could possibly not be lying. This is the most politician-y, word gamey, type of nonsense. I'm not saying what I'm saying is necessarily true. I'm saying that it could be true. That is true of every single statement anyone could say about anything, Charlie. And if anything, just shows to me how little confidence you have in your words as he tries to cover his bases. He knows he's spreading disinformation. He knows he's spreading nonsense. And so he needs to cover all of his bases for what he said. So when after the fact people say, Charlie, 100, even the lowest end on this, 123,000, was completely wrong. And that high end of 1.2 million would have been double the current COVID deaths. And you're saying that's because of the COVID-19 vaccine. That's a wild claim, and there was no evidence to prove it, and you were completely wrong. And he can say afterwards, well, I did say that I did say that I wasn't saying it was true. I was just saying that it could be true. He's covering his bases. Again, I'm not saying I'm lying. I'm saying that I could possibly not be lying. Let's listen to the clip.
So as we've been talking about throughout this entire hour, the new VAERS data, according to the CDC website, VAERS is a public portal that you can plug into the Vaccine Adverse Event Reporting System, shows that there is as many as 12,313 deaths after getting the vaccine. We've also gone into detail about how the VAERS...
Okay, that's 12,000. That number is very distant from 1.2 million. Let's just say that those numbers are very off.
And the FDA, according to this study of the Electronic Support for Public Health Vaccine Adverse Event Reporting System, shows that it really might only reflect 1%. So, if VAERS is off by 99%, that would mean 1.2 million people died after getting the vaccine.
That's just wild speculation. You have no evidence to prove it. None. It's just wild speculation. And you know it's not true, Charlie. You know it's not true that 1.2 million died. It's literally impossible. If 1.2 million people over the last 6 months just dropped dead, that would be double the total amount of COVID deaths we've had in this country. That would double those deaths. That would be 600,000 people dead from COVID, 1.2 million dead from vaccination. That'd be 1.8 million dead people. Do you think if 1.8 million people just went up and died to the same issue in 2 years, we wouldn't notice? If 1.2 million people just died after getting the vaccine, we wouldn't notice that, Charlie? That somehow all of those deaths were covered up? I mean, again, you're going to cover your ass after saying this widely just out there claim, this speculation. Well, I'm not saying this is true to cover your ass, but you're planting seeds in the minds of people. You should be saying, this is literally next to impossible.
If VAERS is off by 90%, that means that...
See, now listen, now it's 90%. That's going to be 80%. It's going to go down a whole line to make this completely wild range of speculation.
Make sure I get my math right here. That's right. If VAERS is only calculating 10%, that means 123,000 people died. Is that right, Connor? Yeah, 1.2 million. That's right. 1.2 million actually would be... Yeah, that's right. More than double the number of people who
He's still working it out right now live.
have died from COVID in the U.S. I'm not saying that's true. I'm saying that...
He's just asking questions, guys.
According to how we calculate VAERS, by the independent study that was administered, this could be true.
It could be true.
So where are elected leaders looking into this?
You know, if our elected leaders looked into this, I'd have to question the legitimacy of our elected leaders if they wasted our time with this. If a drunken man stumbles into Congress and claims that 50 million people die due to reindeer-related casualties every year in the United States, I don't think there needs to be a select committee open to investigate those claims. They can be rejected on face value. The claim you are making with this wide range of claims can be rejected on face value. It's completely ridiculous. You went from a 12,000 number and then speculated. The reason why they probably gave that wide range is because they're like, we don't have enough data to really figure it out. So, I mean, if you really want to look into it. And instead of you being like, oh, so 12,000, this is the number we should work off of. You were like, let's just go into wild speculation land. 600,000 dead from COVID, about 1.2 million dead after vaccines. Or maybe on the low end, I'll be nice, 123,000. Sorry, Charlie. If that happened, I think we would all notice 1.2 million people just dying out of nowhere. That's like Atlantis sinking into the ocean, like numbers. Like we would notice that. That's like speculating the moon disappeared and we just haven't noticed. Like I think somebody would notice like the moon's gone. Absolutely wild.
First came the virus that had never been seen before, and that spread faster than we could ever imagine. Now we hear there's a safe and effective way to stop it. Vaccines that will protect millions from COVID-19. But can we really know they're safe after less than a year of testing? COVID-19 vaccines may be new, but vaccines are not. We've been using vaccines to protect against infectious diseases for over a century. 2 COVID vaccines are the first authorized vaccines ever to use a new technology, but even that technology, called messenger RNA, has been tested and studied by vaccine researchers for decades. We've learned how to make vaccines better and safer, and we've applied all that knowledge to COVID-19 vaccines. We also had a head start on COVID vaccines thanks to studies the National Institutes of Health had done. Scientists there actually created a vaccine that could be custom-made to fight different strains of coronavirus, like the virus that causes COVID. Using these studies, they were able to make a COVID-19 test vaccine just over a month after the disease was first reported. All vaccines have to be thoroughly tested before they can be marketed. During clinical trials, scientists measure and compare data on volunteers who receive a vaccine to those who receive a placebo, like an injection of saline. Most early clinical trials involve fewer than 3,000 volunteers, so it can take a year or more to get the data needed to measure how well vaccines work. Early clinical trials for COVID vaccines enrolled at least 30,000 volunteers each, so data on safety and performance were collected and analyzed in under 4 months. Vaccines are usually developed one step at a time, and companies wait until they have final approval to start manufacturing them. But addressing this pandemic couldn't wait, so government and industry invested millions of dollars to produce vaccines at the same time their test data was under review. This meant health departments and clinics started getting vaccine shipments a few days after the Food and Drug Administration's rigorous standards for safety were met and the vaccines were authorized for public use. Thanks to extraordinary advances, science, industry, and dozens of government agencies have been able to work together to produce and deliver safe and effective COVID-19 vaccines in record time. Decades of experience and innovation led to this achievement, one that can keep you, your family, and your community safe from a serious and dangerous disease. Learn more, cdc.gov/coronavirus. We can do this.